my shoeless shoes. Yeah.
This topic is, I would say, important in that what's hard for what we do on the floor is that not only are we fitting a child's foot who doesn't give us a lot of feedback, a lot of information about what they like, don't like, or what's comfortable, but we're also having to fit the expectations of the parent, right? And parents that are going to come here and spend good money on shoes are going to be very involved and very concerned about what goes on their child's foot, right? I think a difficulty is that there's a lot of misinformation about what children may or may not need, and there's a lot of old dogma, I would call it, so maybe even misinformation about how much support a child may or may not need as well. I'll get patients coming into clinic bringing in a child who has no foot pain, no foot problems, and the kid's even kind of exasperated, like, I don't know why I'm here. And the mom's saying, well, they're not walking right, don't they? Or tell them to not wear flip-flops. I've literally had patients make appointments to not wear flip-flops. And I'm not a flip-flop basher. There's some certain risks with it, but of and by themselves, flip-flops are not that bad. But we'll start with a little bit of the basics here. So the development of gait. And I like this illustration that I found on the internet that shows that when kids start walking, they're going to have flat feet, okay? And you guys have had that question, right? Oh, my kid's feet are flat, right? Don't I need to get them into arch sports? No, you don't. We'll talk about that a little bit more. But as a toddler starts walking, they have an abducted gait, they have kind of bow legs, and they don't have a propulsive phase of gait. They kind of walk more like this, right? So they don't go heel-toe, and they don't walk with their feet kind of lined up straight ahead. That's normal. That's not a problem. As they develop a little bit older, say let's say like 3 to 5 years old, they might have a little bit of genu valgum, so their knees are going to kind of buckle in a little bit. This isn't everybody, these are generalizations. They'll buckle in a little bit. Their feet may still be externally rotated, and they still may look like they're flat. But at this point, they're starting to walk with more of a propulsive phase of gait. So that means that they will go up onto their toes and push themselves forward instead of just picking up their feet and moving them forward this way. Then, as they get between 5 and 7, they're actually starting to approach a point where they have normal adult-looking alignment and a normal adult gait. So we look at gait as maturing somewhere around age 7. And of course, with kids, there's a high level of variability. But now they have more of an adult type of movement pattern and a more of an adult type of alignment. The foot impressions here are very typical too. So in fact, I think I have some numbers coming up, but the vast majority of kids look flat-footed as they're toddlers. Their arch will start to develop somewhere between age 3 to 7, and then at age 7 it's a little more normal of an arch in a foot. Estimating foot growth. I don't know if this is crucial, but there was a study that showed some interesting numbers here. You know, and parents will get, they'll ask us, well, if I get a little bit bigger, how long are these going to last? Or when will I need to come back for shoes? It's actually relatively frequently. So under the age of 15 months, a kid typically grows about half a size every 2 months. Jim is going to have some of these slides too, so we'll be able to share them with you. And then between 15 months and 2 years, they grow a half size every 2 to 3 months. So they're kind of slowing down a little bit. Between 2 and 3, it's a half size every 3 to 4 months. And then between 3 and 5, it's a half size every 4 months. So basically a kid is looking at needing, between 6 and 4 pairs of shoes per year. Kids tend to mature or reach their adult size foot for females around age 13 and for males around age 15. Again, those are ballpark figures, but a lot of times our parents are asking us questions about that. This quote from Stahelli in 2006, children who go barefoot have a lower incidence of flat feet and deformity while having a greater foot flexibility than children who wear shoes. So their study looked at cultures that don't wear shoes or wear very just maybe sandals and compared them to developed countries that wear footwear. So there are differences in how our feet grow and evolve based on the footwear we use. Now, back in the 70s and 80s, they used to say, well, you have to wear shoes to help your arch develop. Now, research never supported that or borne that out, so we know that actually is not true. So you don't have to have support. In fact, according to Stahelli's research, we'd say that it'd be better if we didn't have shoes on as much as we're developing. 50 to 64% of children in a British study in 2011 showed kids were wearing shoes that didn't fit well. You guys, I'm sure, have seen that on the floor. That's very common. And sometimes, too, when it comes to children, it's not just maybe that they don't fit well. It's also that they're often worn out quite a bit, or the kid doesn't like unlacing the shoes, so the upper's all stretched out, or it's a hand-me-down shoe. So the question that we get a lot, I know you guys get it too, is, do flat-footed kids need support? And I would say no, they don't. And I would also tell any parent that I see in clinic, if a kid doesn't have pain, there's nothing to treat. We don't treat things that are painless. So if they have a concern about how a foot's developing, I'll talk a little bit about what's normal. But I also emphasize that if your child starts to complain of pain, and kids are different this way too, they don't always tell you something hurts. In fact, there are studies that suggest kids don't sense pain the same way that we do. Not that they don't feel it, but what I'll ask a child in clinic is, do your legs get tired? Or do you feel like you can't keep up with your friends as well when you're running or playing? And sometimes those are indications that maybe their feet are unstable or they have to work harder to move, even though they may not specifically be having pain. But also when it comes to footwear, we know that we can't create an arch. So that's what parents ask a lot too. If I use an insole for a few years, will he develop a normal arch? No, that will not happen. Same thing with adults. Same thing with a shoe that has, stability or motion control device. We're not changing how that foot structure develops in terms of developing a more stable alignment or creating that arch. Also, what I think is important is you have to remember that footwear is a filter, and this applies to everybody, not just kids. But there is a study that showed that toddlers who go barefoot learn to walk sooner and they fall less than toddlers that wear shoes. So, we live in a culture where we start wearing shoes before we can even walk. I think one study I came across showed the average child's first pair of shoes is around 8.5 months. Most kids start walking around 10 to 16 months. So even before we learn how to ambulate, we have this filter on the bottom of our foot. And you guys, the whole barefoot and minimalist debate has raged, but there are certain things that are undeniable about it, and that is that footwear affects movement, and footwear does mask sensation. It's like wearing a glove on your hand. So I do encourage parents to let their kids go barefoot as much as possible, and the shoe really is just to protect the kid from environment. It doesn't have to be anything more than that. We'll talk a little bit about some of the common foot conditions. The good thing is kids don't typically get a lot of foot pain or foot problems. In fact, I can tell you, I spent some time last night just looking to see what's out there on the internet, because that's the other thing is our parents come in and they've done some looking on the internet to see how to fit the kid's shoe or what's the best shoe for kids. And there was a website I came across that said kids will get plantar fasciitis if they wear poorly fitting shoes. That's not true. I've been practicing since '99. I've seen 2 kids that had plantar fasciitis. Kids don't get plantar fasciitis. They get something called Sever's disease, and we'll talk about that a little bit. The other thing is, this article also said that if the kids wear shoes that are too tight, they'll get hammer toes. There's no research that shows that, and kids don't typically tolerate chronically small shoes anyway. So there's definitely misinformation out there, and that's what makes the job tougher, right? Because when a parent comes in and they've got an idea in their head, my kid has plantar fasciitis because they wore their flip-flop too much. Well, we can't really say that that's true, but we have to kind of toe a line and say, okay, they're concerned because their child has pain. They think their kid needs more support. We can't tell them, no, you can't have support because there's no research to indicate that your child needs it. So we kind of have to, give them what they're looking for, but at the same time still giving their child a good fit. What is more common when a child has heel pain is something called Sever's disease. I don't like using that term because when I say disease to a parent, they're going to freak out. And so I use the word the term calcaneal apophysitis. It's a little bit bigger word, but it's a little murkier. It's a self-limiting condition. So basically it means, hopefully you guys can see this, there's a growth plate in the back of the heel here. This growth plate matures around age 12 to 14 for kids. And so whenever they have pain, and typically they're going to point to the back of the heel. And normally, if it's an adult, we're going to say, oh yeah, probably plantar fasciitis, maybe Achilles tendonitis. But with this, the growth plate becomes inflamed it can be for a number of reasons, but typically you'll see that with kids that are pretty active. The mom will say, well, she dances on Mondays, she plays soccer Tuesdays and Thursdays, and then she's also doing a gymnastics class. Some kids it's just soccer, just baseball, whatever, but a lot of times the busier, the more active they are, the more prone they might be to this. So it's self-limiting, which means that when the child matures, that growth plate closes, and you never get calcaneal apophysitis once the growth plate is closed. It doesn't mean they'll have pain until they mature. There's simple things that I do in clinic that you guys even can do in the store. A lot of times it is a good shoe. Heel cushions, heel cups help with this condition. And then if it is a kid who demonstrates, and these kids are going to be, like I said, probably between 8 and 12 when you're seeing them in the store. These kids have the adult gait, right? And they have probably more of a normal or adult alignment of their foot. If it does look like a pronated foot, and I would tell you there's no science to say how much pronation is too much pronation, but I will try an insole for them too. On occasion. Typically they'll start them with the heel cushion and then tell them to consider an insole later if they're still having problems. And then they treat it symptomatically, icing, anti-inflammatory. Some kids do need to decrease their activity, but I normally try not to start there for anyone. Whether they're a runner or a kid playing baseball, I usually say, let's try to support and protect your feet better, see if that helps. If it doesn't, you might have to decrease some activity. But yeah, kids, if a parent comes in and says my kid has plantar fasciitis, you don't have to tell them they're wrong, but in your head just say, okay, it's probably calcaneal epiphysitis. I usually ask right away, well, how old are they? Then if they're in that 8 to 12, sometimes 8 to 13 range, then they're probably dealing with it, especially if they're athletic or active. The other condition, and this is kind of what I was talking about earlier, I'll get a parent coming in and say, oh, she's walking wrong, look at her, she's totally in-toed. Well, there are a certain segment of kids that are going to have unusual alignment, whether they're externally rotated or internally rotated. These are called rotational deformities. And I can tell you the vast majority of them, we can't really do anything for anyway. Now, the vast majority of them are also painless. If it's painful and a rotational deformity, that's, to be honest, something they need to go to Gillette Children's Hospital for. Very few of them need that. So parents feel like, well, if they're in-toed, isn't there a shoe that can push them out? Well, we know there isn't. Same thing if they're externally rotated, is there a shoe that can push them in? No, in fact, the only way you can control these rotational or transverse plane deformities is by big braces. And they used to do that in the 50s, 60s, and 70s until they realized that kids don't tolerate them and they didn't make a difference. So those things are out the window. We don't need to use things like that anymore. And if you think about footwear and how it can affect things, there's, footwear really only affects the frontal plane, the side-to-side motion here, and the sagittal plane. But there's nothing that can, in a shoe, that's going to make someone internally rotate or externally rotate to compensate for something. So this is a concern that a lot of parents have, and there's nothing that you can really do about it. One just little side note that I'll give you is, a lot of times I'll have a kid that internally rotates run for me in clinic, and a lot of times it actually corrects itself. So their walking gait, they might be internally rotated, but if you have them run, they actually look really nice. So again, something that tends to be not symptomatic or not painful, and we don't treat things that don't hurt. Other common conditions is obesity is one of them. And so there is getting to be more and more research that shows kids that are obese have different shapes to their feet and might be prone to other problems down the line. So no one's really done a long-term study because childhood obesity is a relatively new problem. No one's had a large group of kids that they followed, let's say from age 5 up to 25 or 55. But Dowling's study in 2001 showed that there are higher plantar pressures. So even though an obese child's foot is going to spread out, it's going to be wider, longer, flatter, you would say, okay, they probably have a bit better surface area. Well, they do. They have a bigger surface area, but the pressures in their midfoot and underneath their metatarsal heads are higher than kids that aren't obese. So, and we're not going to be talking about obesity with our customers here, but in our mind, we're kind of thinking of those things, right? It's like, okay, this if the kid has pain, of course. And so long-term effects, we're probably going to have some interesting studies coming, but right now we don't really have them.
My shoeless